Good morning everyone, myself Arthi, Assistant Professor, Medical Surgical Nursing Department from ES College of Nursing. So today I will discuss about the meningitis topic. So introduction of meningitis. So meningitis is a disease caused by a inflammation of protective membrane and covering the brain and spinal cord known as meninges. So meninges, it is the covering layer of the brain. So meningitis, it just means it is the inflammation of the covering layer of the brain. Okay, so this is the inflammation usually caused by an infection of the fluid surrounding the brain and spinal fluid. So once your brain will be infected, so automatically the spinal cord will be infected because of the meninges. It is also covering the spinal cord. And next is the meningitis can be a life threatening, therefore the condition is it is classified as a medical emergency. It is one of the life threatening condition. So next is the definition of meningitis. So meningitis, it is a inflammation of the brain and the spinal cord that may caused by either bacterial or viral infection. So it is means it is a it caused by the meningitis. It is caused by either viral or bacterial infection. Any microorganism that enter the meninges can result in meningitis. So for next is the bacterial meningitis is a serious infection that is spread by direct contact with discharge from the respiratory tract of any infected person. So bacterial meningitis, it is very common one because of persons who are having any upper respiratory tract infections. So easily it is spread to the one person to another persons. And next is the etiology. So already was said it is one of the bacterial and viral infections. So first we see the bacterial names. So first is the bacterial infections. So bacterial names is the Neisseria meningitis, and next is the Streptococcus pneumonia, and third one is the Haemophilus influenza, and third one is the Listeria monocytogenes. And next is the viral meningitis. The viral name is Herpes influenza virus, HIV mumps, and Wisnal virus. And last one is the fungal meningitis. Okay, so next we'll move on to route of entry. So route of entry, the first it is enter into the bloodstream. For example, insect bites or any otitis media. So otitis media means it is an inflammation of the middle ear. So it is an infection inflammation of the middle ear. So persons who are all having the untreated otitis media, so one of the complication it is called as meningitis. The bacteria it is enter into the meninges and affect the brain covering layer. So next is the direct extensions. So it is a fracture or frontal or facial bones. So next is the cerebrospinal fluids. It's a dural tears or poor sterile technique during the procedure. So if any procedure done for the lumbar puncture, so it is a unsterile procedure. Now the time the infection it is easily spread to the spine, it is reach the brain. Okay, and next is the nose or mouth. Next is the meningococcus meningitis. In case of patients having any nose or mouth, the infection name is called as meningococcus meningitis. Next is the in utero. It is a contamination of amniotic fluids, rubella, vaginal infections. And next we will move on to pathophysiology of meningitis. So due to etiological factors like that, causative organism enter into the bloodstream. So in previous slide I was discuss about the causes of meningitis. So for example, causes like that otitis media or any unsterile technique of CSF fluid aspirations. So these are all the etiological factors. The organism enter into the bloodstream, it leads to the cross the blood-brain barrier. So once the bacteria enter into the bloodstream, it is cross the blood-brain barrier. It leads to proliferates in the cerebrospinal fluids. It leads to release of cell wall fragments and lipopolysaccharides of microorganism, and it leads to the inflammation of subarachnoid and biometer. So subarachnoid biometer, it is a layer of the meninges. So meninges it is again divided into three layers. The other is called the subarachnoid biometer. Next is the CSF circulates through the subarachnoid space. The inflammatory cellular materials from the affected meningeal tissues enter and accumulate. And next we will move on to clinical manifestation of meningitis. So first is the nuchal rigidities, next is the altered mental status and confusion, next is the petechial rashes, especially within Neisseria meningitis. And these are all the clinical manifestation. And next is the fever, headache, and photophobia. And next is the sign of meningitis. So two sign of meningitis. It is known as positive Kernig signs and positive Brudzinski sign. So first we'll see the positive Kernig signs. The patient is lying in supine with the thigh flexed on the abdomen, slowly extended the upper leg, resulting pain and spasm of the hamstring muscles. And next is the positive Brudzinski sign. It is to elicit Brudzinski's sign, place the patient and supine and flex the head forward, result and flexion of the hips, knees and ankles with the neck flexion indicate the meningeal irritation. This is called as Brudzinski sign. So this is the picture of positive Kernig sign and Brudzinski sign. So first it is the Kernig signs. The one of the physically demonstrable symptoms of meningitis is Kernig sign. Severe stiffness of the hamstring causes inability to straightening the leg when the hip is fixed 90-degree angle. So it is called as Kernig sign and comes in the Brudzinski sign. So one of the physical demonstrable symptoms of meningitis is Brudzinski signs. The severe neck stiffness causes a patient's hips and need to flex when the neck is flexed. It is called as Brudzinski sign. And next we'll move on to complication of meningitis. So first is the brain damage, and next is the seizure, and next is the hearing loss, and next is the memory difficulty and learning disabilities, gain problems and kidney failure, shock, at last is the death. These are all the things complication of meningitis. So next is the diagnostic evaluation. So in diagnostic evaluation, so first is the history collection. So in history collection, to collect the past medical history of patients having any upper respiratory tract infections like the otitis media or any fracture, especially in the facial bone or a skull fracture patients having or not. This is all the one of the causative causes for the bacteria or virus or any other organism enter into the brain. Okay, and next is the in physical examination. In physical examination, you will be identify the patient signs and symptoms. Okay, and next is the CBC count. And next is the blood culture or obtained to indicate the organism. So blood culture, it is help to identify the growth status of the what type of organism will be growing on the blood. Okay. Next is the lumbar puncture. So lumbar puncture, it is help to identify the CSF fluids analyzer. So in CSF fluids, it is help to identify the composition of CSF analysis. So leukocytes, proteins, glucose, and normally as 5 or fewer lymphocytes are mononuclear cells. Okay, next is in MR and CT scan with and without contrast rules of the any other disorder. So MR and CT scan, it is to identify the damage of the brain, tissues and blood vessels. These all the things will be identified the MR and CT scan. Next is the serological test such as latex agglutinations may be positive for antigens. Next is the management of meningitis. So first is the yearly administration of antibiotics cross the blood-brain barrier into the subarachnoid space in sufficient concentrations to reduce the multiplication of bacteria. So first management is the antibiotic because of it is one of the bacterial infections. Okay, and next is the vancomycin hydrochloride in a combination with one of the cephalosporin and cephistone sodium administered intravenously IV to administer the vancomycin and cephistone. And next is the antiviral drugs. So the meningitis, it is caused by viral also. And next is the dexamethasone and 10 to 20 minutes before the first dose of antibiotic and every 6 hours for the next 4 days should be admitted. And next is the antipyretics. So antipyretics, it is help to control the fever. So fever for the patient. So patients having the high fever because of the infection, antigen antibody reaction will be started in the brain this is the reason for patients getting the pain. So administer antipyretic medicines. And next is the dehydration and shock are treated with fluid volume deficit. And next is the seizure or control with phenytoin. Next we'll move on to nursing management. So first is the assessment of the patient. So assessment of the patient is the obtaining history of recent infections such as upper respiratory tract infection and exposure to the causative agent. So to collect the history of recently you're having any upper respiratory tract infection, especially in the patients having any otitis media or any tonsillitis or any recent dental problems. These all the things it will be collected. Next is the assess the neurological status and vital signs. So to assess the neurological status and vital signs, because of patients having the fever and changes the patient breathing pattern. Next is the evaluate for sign of meningeal irritations, especially in the you will be find out the patients having any positive sign of Brudzinski sign and Kernig sign. Next is the assess the sensorineural hearing loss, vision and hearing. You do the neurological examination, especially in the renin and Weber test, to identify the patients having any sensorineural hearing loss or not. Next is the cranial nerve damage. You do the 12 pair of cranial nerve examination. Next is the diminished cognitive functions. Next is the nursing diagnosis. So nursing diagnosis. So first is the hypothermia related to infection process and cerebral edema. So hypothermia, it is patients having the fever. So it is according to the priority wise, you will be give the first care for the patient like that fever. So hypothermia related to infection process and cerebral edema, to give the debispange for the patient to reduce the patient body temperature. Okay, next is the ineffective tissue perfusion related to infection process and cerebral edema. Next is the acute pain related to meningeal irritation and Nuchal rigidity. And fourth one is the impaired physical mobility related to prolonged bed rest. And next is the risk for imbalanced fluid volume related to fever and decreased intake. And last is the risk for injury related to positive culture in CSF fluids, Cerebrospinal fluids. And next is the first intervention is the fever. So reducing the fever, to administer the antimicrobial agents on the time to maintain optimal blood level. Next is the monitor the patient's temperature frequently or continuously and administer the antipyretic as orders. Last is the to institute other cooling measures such as a hypothermia blanket as indicated. Next is the maintaining fluid balance, to prevent eye fluid overload, which many worsen cerebral edema. Next is the monitor intake output closely and monitor central venous pressure frequently. Nursing intervention, the last is the enhancing cerebral perfusion, assess the loss of consciousness level and vital signs and neurological parameters frequently, observe for signs and symptoms of intracranial pressures, example decreased level of consciousness and dilated pupils and beating pulse pressures, and maintaining the quiet calm environment to prevent agitations which may cause any increased intracranial pressures, and to prepare the patient for lumbar puncture for CSF evaluation, and repeat the spinal tap if indicated, and notify the healthcare provider of sign of disorientations and increasing temperature and decreasing level of consciousness and seizure activities or altered respirations. And next is the reducing pain, to administer analgesics as ordered, monitor for response and adverse reactions, and avoid opiates which mask a decreasing level of consciousness, and darken room if photophobia is present. And next is the assist with the position of comfort for neck stiffness, and turn patient slowly and carefully with head and neck alignment. And next is the evaluate the head of the bed to decrease intracranial pressure and reduce the patient pain. This is all the intervention for reducing patient's pain. So that's all about meningitis. So in this topic I was discuss about the introduction, definition and the causes, and pathophysiology and clinical features and diagnostic evaluation and medical and nursing management of meningitis. So thank you.